Welcome back to the Big Ideas Theater here at AARC. I'm Ed Highland. I'm joined now by Luis Blanc, who is with the Parc Taulí in Barcelona. Thank you so much for coming and joining us.
Thank you very much.
You've been flying around quite a bit. You were in Ecuador as well as Catalan, and so thank you for making it out here for us. We want to talk a little bit about psychological rationale for prone positioning. First, what have we learned about prone positioning over the last 20, 25 years?
Well, the first initiatives in prone position were even maybe 35 years ago, when we discovered, or some nurses working in the ICU discovered, that patients, when they were placed in prone position, they had much better oxygenation. So then a bunch of people were not worried, but wants to investigate about that, and placing the patients in prone position, we discovered that the physiology is much better in terms of more homogeneous ventilation and perfusion within this diseased lung. So at the end, this translates in much better oxygenation.
Well, give us some thoughts on if it's been successful, if you're getting these positive results, why is it not incorporated more often, in particular ICUs?
Well, this is an interesting question, because there are several factors that influence that. First of all, it requires workload. Attendants able to turn the patient and to stay there. If the manpower in the ICU, it's maybe 3 or 4 nurses per bed, probably this preclude. This preclude to keep these patients or to turn these patients quite often. Another story is that certain diseases, to turn the patients, it's quite complicated. Like, maybe diseases related with the spine, or maybe with the open abdomens in some circumstances, that this makes that really, really difficult. And simply that there are people that they prefer to use other options to improve hypoxemia rather than prone position.
Who has the responsibility to turn the patient, to get them in the prone position?
It depends on countries, and it depends a little bit on organizations like that. For example, in my country, it depends on physicians and nurses, but when the team is well trained, we do a lot of prone position. 3-4 nurses do the turn without complications because they are trained. Maybe, in America, North and South, or even Central America, there are the respiratory therapies that we are here, that probably therapies plus nurses, can do the job. And in certain countries, if there is if a physician is not there, they don't do the turn.
How is the difference, as you've seen, you travel quite a bit and you see it in different countries, so how do you go about explaining, this might be better to someone who perhaps is very set in their ways? Maybe they're not embracing, this as much.
I would say that in Europe, probably we are proning more than in North America. If you ask me the reasons, I don't know. When there is a study looking at the reasons why people don't prone, and some people say, well, maybe it is so sick. When the study said that that people who is so sick, mainly because they have profound hypoxemia, so low oxygen in the blood, turning prone, this turns to be better. So, and also it depends on the options you have to treat hypoxemia. So now, clinicians, we discover that there are certain techniques, which is extracorporeal oxygenation, that might benefit patients, and in some institutions maybe they prefer start with these techniques and to leave more open the issue of the prone positioning. However, in the literature, what is proof is that, and is strongly recommended by many societies, important critical care societies in the world, that prone position is a strong recommendation, to be used in patients with what we call, acute respiratory distress syndrome, which is a severe impairment of the lungs to oxygenate the blood. So the issue is here, and many people say as well, we turn it prone, and if prone don't respond, then we use extracorporeal oxygenation, which I think it's a reasonable option.
So you would advocate that RTs suggest this if it's not being done, or at least tried, then perhaps they should try.
RTs are familiar with that.
Right.
I mean, they do that. There are talks here about about prone position. So it's a great therapeutical option.
Fascinating insights. Luis, thank you so much for coming by and sharing.
Okay, and my pleasure to be here with you and with the American Association of Respiratory Care. Thank you very much.
And this is the Big Ideas Theater at AARC. I'm Ed Highland.